Hello, happy Sunday, Dr. Val back. And today we're going to discuss why am I waking up at 3 a.m. and science-backed tools to help improve your sleep. So if you're a woman in midlife, perimenopause, menopause, above 40, or have someone in your life who has difficulty staying asleep, this video is for you. So who am I anyway? I'm Dr. Val, the innovative sleep medicine physician and women's sleep expert. I've been in the sleep space actually 12 years now, if you're including fellowship. So spend a little time learning about sleep and what are some of the causes. So I think really when you're looking at trying to improve something, you want to take a look at, well, what's causing the problem in the first place. And just from experience and doing literature searches and really talking to people, the common reasons why women in midlife, perimenopause, menopause, around the age of 40 and above, for some people late 30s, have difficulties with their sleep, I would say a big issue are changes in your sex hormones, estrogen and progesterone. Those changes can lead to a whole slew of symptoms. One of the biggest ones that disrupt the sleep are night sweats, hot flashes. And if you know that happens, then you certainly can attest to it can disrupt your sleep. I had some hot flashes in pregnancy, and those were certainly not fun. And even without feeling drenched or sweating, your body temperature can actually rise during sleep, and that can also contribute to poor sleep. Because really, when we sleep, our body temperature is lowered, and that just helps decrease all the metabolic processes and keep us asleep. So it's really interesting. So less estrogen and progesterone can also cause us to have more light sleep. Progesterone is known as sort of a resting hormone, and it helps by working on the GABA system, which is our sleep system, our neurotransmitter system in the brain. So we have lower levels of progesterone that may also disrupt sleep. Along with this period in our life, we can have changes in our mood, anxiety, and depression. And guess what? Those things can disrupt your sleep. A big one to think about when it's something that I do in my daily practice is obstructive sleep apnea. So if you've heard me talk in any of my videos before, I love talking about obstructive sleep apnea, especially in women. Some of the research shows up to 90% is undiagnosed. Well, let's talk about what obstructive sleep apnea is anyway. It's when the muscles of the upper airway, typically the tongue, can narrow and collapse. There's other potential causes in women that we're looking at. They're called endotypes, where women may just have a lower threshold for arousal. And that can also lead to more symptoms of sleep apnea. If it runs in the family, your risk of sleep apnea actually is twofold. And often women don't have the classic symptoms, which are snoring, gasping, choking, daytime sleepiness. Sometimes we have headaches. Sometimes we have more mood disturbances. Sometimes it looks like insomnia. And doctors oftentimes aren't taught how to address these issues in women. And so some of the literature suggests that if a woman's fatigued in the middle age, they get, a pill for an antidepressant, which may help actually improve the sleep if the problem with sleep was anxiety, depression, or may get sent for blood work to get their thyroid checked, which is really important because thyroid can cause some fatigue and sleepiness. But I do encourage you to get tested or screened or just talk about obstructive sleep apnea. So common. Even if it's mild, get treated because those can help with those early morning awakenings, right? Your muscles are relaxing and collapsing, especially during REM sleep. We have more REM periods the second half of the night. And if you're basically not breathing well, you're going to wake up. And then if you're waking up because you've already had about 5-6 hours of sleep, it's really hard to go back to sleep because you've already met sort of the minimum amount of sleep time. So that is something certainly to consider. Circadian rhythms are another thing to consider. Sometimes, let's say if your true internal clock, so your circadian rhythm is your internal clock, if your true bedtime is around 9, you actually have a morning rise of cortisol and a drop off of melatonin, and that can wake you up. So if your true bedtime maybe is 8:39 and then you're waking up at 3, you've already gotten 6 hours of sleep. And so it's your body naturally telling you to wake up and get ready and start your day. The problem is sometimes we push ourselves beyond our internal clocks. And when we want to go to sleep versus get to go to sleep versus should from our biological rhythms, it may not be until 10 or 11. And so sleeping from like 10 to 3 may not feel like enough sleep. So if you're wondering if you have an issue with your circadian rhythm, there's a questionnaire questionnaire called the Morning-Eveningness Questionnaire. I'll put in the comments below and see if that is disrupting your sleep. Other things that can disrupt your sleep are pain. As we get older, sometimes we have some joint pain. I've experienced some shoulder issues of late. We have back issues, we have hip issues. And if you're in the same position for too long, that can be uncomfortable and your body's shifting, trying to get you to wake up. Um, Low blood sugar or high blood sugars, intermittent fasting is really popular. It's actually non-compatible with life if you go too long without eating. And so the normal rise in our cortisol levels in the morning wake us up. And if you have a higher baseline, just from stress in general, you're more prone to wake up. It's not a bad thing. Actually, sometimes cortisol is really villainized, but it's really good to have cortisol because you want to have that system to wake you up. Because if your blood sugar goes too low, then that's not a good story. When I was working with a patient in the hospital, I think there's one lady that I can remember. She got a little bit too much insulin, and then she developed a lot of memory issues and dementia after that. So yeah, your brain needs glucose. Medication side effects, something certainly to consider as well. Some of the medications that we're put on for high blood pressure, diabetes can disrupt the quality of sleep that we have. Sometimes antidepressants can be more sedating or more insomnia provoking. And then another one is waking up to urinate, which actually could be from untreated sleep apnea. So always linking things back to treating your obstructive sleep apnea. But also as we get older, our bladder muscles don't work as well, aren't coordinated. If you have diabetes, that can cause someone to wake up to urinate. We're always told to drink a lot of water. That can also cause you to wake up to urinate. So if you have that where you're waking up more than 2 times a night, nocturia, go talk to your doctor about it and get some treatment options. All right, so what are the science-backed tools to help improve my sleep if I am waking up at 3 a.m. in the morning? And I reviewed this article. It's called Treatment for Chronic Insomnia Disorder in Menopause, Evaluation of Literature. Was from the Journal of North American Menopause Society. I'll link it in the comments below. And it was really, really helpful, sort of breaking down different treatment options. And number one, honestly, is hormone therapy. If you think about it, right? If you have fluctuating levels of estrogen and progesterone, how can we help you get better sleep? Well, being on hormone therapy actually can improve vasomotor symptoms. Those are hot flashes, night sweats, body temperature rises, and also chronic insomnia. And they've actually done randomized control trials, right? So taking an intervention group and a control group, and then just really seeing what happens. And these trials were for 5 years. And the women who were participating in these studies did report better subjective sleep and vasomotor symptoms. So that's fantastic. Also, double-blinded studies with estrogen. So double-blinded means that the people running the study didn't know which group of women were in the control versus the intervention, which is really helpful because if you're a part of the study, it could bias some of the results. Sleeping pills, sometimes, it can be really awful and you ask your doctor for a sleeping pill. They can help improve your sleep, but not necessarily your vasomotor symptoms. And if you're on them for too long, we really caution people because it makes you feel sedated, which is the good thing. But if you wake up to urinate in people who are over 65, senior citizens, we do see people sort of falling and breaking hips, which is not a good thing. And also increased risk for memory impairment and dementia. So it's something to be concerned about, especially sometimes we already have a lot of brain fog as we go through the change. In terms of, do all studies show that hormone therapy is helpful? And I've actually seen people who come to my clinic, they're already on hormone therapy and they still don't have great sleep. So some of the studies are mixed. Some do report an improvement in subjective quality, but when we bring them to the lab and we do the polysomnogram, the data in the lab doesn't necessarily show improvement. So it really just depends. This type of medicine really should be personalized for you. I have a guide that I can also link before. You can take a look at all the different things that can contribute to poor sleep during perimenopause and menopause. And sometimes, right, there isn't a pill to fix everything. Like sometimes I see people who are in broken relationships or lonely, and really having a community to support you can help over a pill. Have a good therapist that you like and trust. Another thing that probably is underutilized in the sleep world and menopause world is cognitive behavioral therapy, specifically for insomnia. It's just a set of behavioral tools, mindset shifts, cognitive restructuring. You learn about sleep science, you learn about relaxation, and it does help improve your sleep. anxiety and depression. Mindfulness on top of that, on top of cognitive behavioral therapy, has been shown to really help improve symptoms of menopause as well. Another viable treatment option is high intensity exercise. And what do I mean by high intensity? Well, this research talked about aerobic exercise 50 minutes a day, other studies, maybe like 3 to 4 hours a week, and it improves sleep quality and vasomotor symptoms. So it's always good to move our body. I don't think exercise is ever a bad thing unless you overdo it and hurt yourself. Another thing that I like doing in my own clinical practice, for those of you who are based in either Hawaii or California, I do perform clinical hypnotherapy. And the way that works, it just works on different pathways in your brain to teach you, sort of new things about sleep. A lot of it is positive psychology or post-hypnotic suggestions. And clinical hypnotherapy does improve sleep quality and vasomotor symptoms from a randomized control trial, which is awesome. And last but not least, always talking about obstructive sleep apnea. So common. Get tested and treated for it. You can do it in the comfort of your own home. You don't have to have a mask on your face. I have obstructive sleep apnea myself, and a lot of people are concerned about those masks that are really big. This is a smaller mask, and it fits just underneath my nose like that. It's pretty comfortable. The first 2 weeks are pretty bad, but your body can get used to it, especially if you notice physical benefits. For me, I feel less sleepy, wake up more refreshed, and who doesn't want that? Other things that maybe have lower quality evidence but have been studied are yoga, massage, and acupuncture. But I think the message at the end of the day is, if you are waking up in the middle of the night, try to figure out why. Hopefully this video was helpful to sort of illuminate potential reasons and talk to a healthcare professional about what treatment option would be best for you. All right, ladies, until next time, if you have any comments, put it in below. I do have a community of women who are interested in getting better sleep, and that's in the school SKOOL community. You can see the link down below, and I'll see you next time. Bye.